What drug is bought every 3 seconds in America? If you said isobutyl propranolol phenylatic acid, you would be correct, and you're probably a chemist or an expert in analgesia. But for us commoners, we call it ibuprofen. In the 1950s, there was a scientist known as Dr. Stuart Adams. Him and his team were trying to come up with solutions for arthritis. At the time, the best drug was high doses of aspirin, which did help with pain and inflammation, but it had a ton of side effects, like stomach ulcers, bleeding, and allergic reactions. Now, aspirin and this new drug, ibuprofen, sits in a family called NSAIDs, non-steroid anti-inflammatory drugs. They work by blocking an enzyme known as cyclooxygenase or COX, which normally makes prostaglandins, a chemical which leads to things like pain, inflammation, and fever. But cyclooxygenase comes in two flavors: COX-1, which produces prostaglandins for blood clotting and stomach protection, whilst COX-2, which is more about pain, inflammation, and fever, and regulating kidney function. When we look at aspirin, aspirin more closely blocks COX-1, so in high doses, yes, it will help with pain, inflammation, and fever, but it's going to cause side effects like blood bleeding because it's blocking blood clotting and stopping the protection of the stomach, so we're getting stomach ulcers. Now, ibuprofen blocks a little bit closer to COX-2, less of COX-1. So we do see good use of pain, inflammation, and fever, with less effects to bleeding and stomach ulcers that we see with aspirin. So when we look at ibuprofen, particularly in the short-term use, it is very effective for things with pain, inflammation, and fever, so headaches, migraines, period pain, muscle and joint pain, with being a little bit gentler on the stomach compared to aspirin in high doses. But it can stress the kidneys, so it's important that if you're going to use this drug, you talk to your doctor and pharmacist before use.